management of aromatase inhibitor-related pain and other symptoms with acupuncture. I think acupuncture plays a huge role in clinical care today, especially in cancer patients, but more broadly for patients who have a variety of problems. So let's start with explaining a little, for those of you who are not familiar with aromatase inhibitors, explain a little about it. Aromatase inhibitors are the main hormonal treatment for postmenopausal ER-positive breast cancer patients. And aromatase inhibitors have been very well studied, and they are known to increase survival, decrease risk of recurrence, and lower the risk of contralateral breast cancer. So you can see that aromatase inhibitors play a huge role in the treatment, care, and survival of cancer patients. Is that better? Okay. However, aromatase inhibitors, as effective as they are medically, have very serious side effects. Aromatase inhibitors are associated with increased risk of musculoskeletal symptoms, and about a third of all women treated with aromatase inhibitors suffer from severe joint pain, that is arthralgia, or muscle pain, or myalgia. These problems are very serious, not only because they affect quality of life, they decrease quality of life, but also because they influence adherence to treatment. Sometimes the problems get so serious that patients stop taking the very treatments that can save their lives. So if there is some way we can reduce these serious side effects of this excellent treatment, it would be extremely important. And that's where this presentation is going. The primary side effects associated with aromatase inhibitors are pain, arthritis, and arthralgia. And these problems were the first ones documented as treatable with acupuncture by the United States National Institutes of Health Consensus Conference in 1997. The website at the bottom right, you can click on that and get for free the entire consensus conference. But it's quite old now, and you really don't need it, because since 1997, there have been numerous controlled clinical trials. All of these studies have supported the role of acupuncture for the control of pain, including joint pain and the other aches and pains associated with aromatase inhibitors. So let's look at some data. Quote, women with aromatase inhibitor-induced arthralgias treated with acupuncture had significant improvement of joint pain and stiffness, which was not seen with sham or placebo acupuncture. Acupuncture is an effective and well-tolerated strategy for managing this common treatment-related side effect, and this comes from a randomized, blinded, sham-controlled trial, the best kind of study that one can do, and the kind that we should all aspire to in trying to study the efficacy of any complementary modality. A little more data. Quote, postmenopausal women with stage 1 to 3 breast cancer who reported aromatase inhibitor-related arthralgia were enrolled in a single-arm feasibility trial. Patients reported a reduction in pain severity from 5.3 to 1.9, reduction in stiffness from 6.9 to 2.4, and joint symptom interference from 4.7 to 0.8, all considered joint symptoms, that is, all patients considered their joint symptoms, quote, very much better. Still more data. Quote, recent advances from published clinical trials added evidence to support acupuncture for symptom management in cancer patients. Recent new developments include aromatase inhibitor-associated arthralgia in breast cancer. This comes from an overview by my friends and colleagues at the Dana-Farber Cancer Center The paper is called Recent Advances in Oncology, Acupuncture, and Safety Considerations in Practice. These are just samples of the data and the results that are available if you go on PubMed or any other source of information about published research data. For those of you who are not that familiar with acupuncture, let's look at it a little more closely. So what is acupuncture? Well, acupuncture is something that uses, naturally, acupuncture needles. We went through this a bit previously, but let me just mention that the needle in the center with a red top is a standard acupuncture needle. The entire length of the needle is not inserted into the patient. Only a small bit, a few millimeters, goes into the patient. When we do placebo-controlled trials, we use a needle just like this. The difference is that the needle actually retracts into the red handle, so the patient can feel the needle sitting on the skin, but the needle does not go into the skin. It's important to understand that acupuncture needles are single-use, sterile, disposable, and they are filiform, which means they are not hollow, so they are very, very thin, about the width of a human hair. If you compare acupuncture needles to the blue top needle on the left, which is a standard hypodermic needle used in hospitals, you can just see by looking at the two how much thinner the acupuncture needle is. On the top right, there is a round blob. It doesn't look like very much, but it is actually an acupuncture stud. It's an intradermal needle, which is a tiny little acupuncture needle embedded in a sterile bandage, and the needle is placed into the skin and left in place. I can tell you that we did a study using these needles, these intradermal needles, these little tiny miniature thumbtack-looking needles, compared with regular needles, and they do not work. They come from France. They come from other places as well, but the ones that we used were manufactured in France. They were very high quality, but unfortunately, they did not do the job. So we have discarded those for all future trials, and we use only regular acupuncture needles going forward. Of all of the complementary therapies, acupuncture enjoys the most credibility in the medical community. And that is because there is a substantial body of data showing that acupuncture has measurable and reproducible physiologic effects. Understanding and describing its mechanisms of action in modern scientific language will further advance the field, and many of us are engaged in just that effort, in trying to show in modern terms what the mechanisms are, so that we can convince people that acupuncture is not a placebo effect. Of course, everything has a bit of a placebo effect, but by and large, acupuncture is very effective in treating a wide variety of problems. Well, the traditional theories of acupuncture are based on the idea of meridians. There were said to be 6 vertical meridians on each side of the body, and these were said to be channels through which energy flowed. The idea was that the energy, or called qi, which is a vital energy, could be influenced by pricking with needles along the meridians. So inserting needles at defined points along the meridians was thought to regulate the flow of qi and produce clinical effects. That's the traditional theory that came from China from maybe 3,000 years ago, probably even before that time. The current status of understanding is a little bit different. We now understand that qi and meridians are not visualized, cannot be detected or determined with any modern scientific tools. Chances are they do not really exist. The strongest research evidence comes from studying the nervous system, because acupuncture appears to regulate physiologic and psychologic functions via the nervous system. So acupoints and meridians, the basis of ancient acupuncture, have no unique anatomic structures to which they are related. But they do coincide with trigger points, with nerves, with blood vessels, and with myofascial planes. Acupoints themselves, the places where you put the needles, are called acupoints. Those acupoints are rich in nerve endings. That's been very well studied and very well established. So acupuncture mechanisms have indeed been researched, mainly in these three areas: nerve conduction, neurotransmission, and with functional MRI equipment. So if you look at acupuncture and nerve conduction, it is very clear that acupuncture improves nerve conduction, and adding electrical stimulation to the end of the acupuncture needle accelerates nerve repair. It is likely that through this mechanism, we are able to reduce neuropathic pain and other problems associated with what we call neuropathy. This has been studied widely. I'm just giving you one indication, one reference, and one picture. But it's very clear that acupuncture improves nerve conduction. We also know that acupuncture acts at multiple levels of the brain. Wherever you put the needle, it eventually ends up somewhere in the brain to release something and to provide the benefit. So, for example, if we look at endogenous opioid neurotransmitters, we can see some animal studies that are absolutely fascinating. If you give acupuncture to a rabbit, the first box on the top, rabbit A, and you take cerebrospinal fluid from that rabbit and inject it into another rabbit, that second rabbit will have analgesia. In other words, the benefit of acupuncture can get transmitted through the cerebrospinal fluid to another animal. This is just amazing if you think about it. I'll show you something even more amazing. We know that response to acupuncture varies from patient to patient. This is true for any kind of treatment, medicines of all kinds, good responders and poor responders. People are different from one another, and they're not robots, and we have to expect these differences. One reason that there may be differences in acupuncture response across patients is that there may be a genetic predisposition. And this is thought to be possible because the studies show that some inbred strains of mice are more sensitive than others to electroacupuncture. In fact, mice lacking the beta endorphin gene show no pain relief, no analgesia. Acupuncture has also been looked at with fMRI studies, and I think these are the most striking studies of all. You're all familiar with fMRI equipment. This is a picture of an fMRI, functional fMRI machine, and it takes pictures of the brain and shows where in the brain something is happening. So this is an especially interesting report. Areas that light up with analgesia are the same that light up with acupuncture. And you can see this even more clearly in this study. The first two rows show acupuncture, actual real acupuncture results when acupuncture is used in the left leg and the left hand. And you can see that the areas of the brain light up in the right places according to those acupoints. In the third row, the one that's called minimal acupuncture, that did not happen. And in the bottom row, if you just do light pricking, nothing lights up. So this shows very clearly that acupuncture is having a profound effect on what's going on in terms of brain release of endorphins, no doubt, but a profound effect in brain activity, whereas the slight acupuncture and just the pricking have no effect. Many people have claimed that the effects of acupuncture are placebo effects. That is not likely for the following reasons. First of all, we see acupuncture analgesia in animals, in little children, and the effects are higher than the expected 20 to 30% placebo effects in all chronic pain studies. There is always a placebo effect with anything that you do to a patient. So when in our research, we always look for a benefit that is higher than the placebo effect, which we can estimate as somewhere around 20 to 30% of patients. And finally, the strongest evidence that acupuncture is not a placebo effect is that in randomized placebo-controlled clinical trials, acupuncture is seen to be beneficial, whereas the controlled acupuncture, the sham, the placebo acupuncture, or the absence of acupuncture has no effect. There are many studies in the literature, good studies, that show that acupuncture reduces various symptoms associated with cancer. Not only those that I described previously, in addition to pain, hot flashes, fatigue, anxiety, depression, insomnia, and so on. Acupuncture is safe with minimal side effects, and it's clinically effective for the management of these symptoms. This is a quote from Jackie Filshy, who was in London, a very senior acupuncturist and author of one of the major acupuncture textbooks in the world. And I think the important thing that's not stated in that quote, which I would like to reiterate, is that this is true. Acupuncture is safe with minimal side effects only if the acupuncture needles are sterile, single-use needles. There are other cancer patient symptoms that are well treated with acupuncture, and we use acupuncture in our clinic for these and other problems: arthritis, xerostomia, neuropathy, nausea, fatigue, hot flashes, stress, depression, and anxiety. There are cautions, of course, especially for hematologic patients. When women are pregnant, we have to be extra careful. If someone has a pacemaker, we probably would not do acupuncture. If a patient is emotionally unstable, or if it's a very young patient, we would probably use acupressure rather than acupuncture. There are specific contraindications. And by the way, if any of you would like the actual full list of our cautions and contraindications, you're free to email me and I will send them to you. It's a page of more detail than is presented here. But the contraindications in our hands for acupuncture are if there is an active infection, if there's active bleeding of any kind, if there is neutropenia or thrombocytopenia. Acupuncture has been studied and found to have no effect on structural deformity, on acute trauma problems, and on dementia. So the conclusion here is that acupuncture is a safe and effective treatment for aromatase inhibitor-related pain and other symptoms. It has few, if any, negative side effects. It is inexpensive and tolerated well by people. I wish they were all here to share in this wonderful conference. Muchas gracias. I'd be very happy to take any questions. Pablo, there was a hand up over there, gentlemen.
This is yours.
Thank you. Yes. Yes, thank you.
Las preguntas las pueden hacer en español si quieren, porque ahora la doctora tiene ella los auriculares. ¿Sí? Doctor Cassileth, esta pregunta dice, si usted afirma, ¿por qué afirma que la inestabilidad emocional es algo que que hay que tener cuidado cuando uno hace acupuntura? Esa es una pregunta. En las contraindicaciones o precauciones. La otra es si no está indicado en depresión el tratamiento con acupuntura. No sé qué dice. You may answer the first one. La primera pregunta es, entonces, ¿por qué la precaución de acupuntura cuando el paciente está inestable emocionalmente?
People who are seriously unstable emotionally, people who are psychotic, are going to have a negative reaction to anything that you do to them. And it is just a dangerous situation. We very rarely, in the cancer field, in oncology, we very rarely see patients who are that seriously mentally ill. But I would caution you to do anything with a psychotic patient. You have to take great care. They can lash out. They can increase the psychotic experience. They can bring a lawsuit against you because they can claim that the acupuncture made demons come into their heads. I mean, who knows? But it's something that we take very seriously, and so does every oncologist and every physician. You have to take extra cautions under any circumstances with any kind of treatment for such patients. And the second part of the question was depression. No, depression, acupuncture is effective in treating depression, but not serious chronic depression. It may help in addition to standard medications, which we are often involved in. That is, we treat patients who are severely depressed with acupuncture when they are also on medication. There are many patients whose depression is not serious enough to warrant a PO by mouth medications, and certainly we treat them without any difficulty. It's a very common use of acupuncture.
Creo que la pregunta que la hizo la misma persona tiene que ver en la interpretación de la depresión como un estado de inestabilidad emocional. Y si eso sería una dificultad de pacientes depresivos o que están cursando un cuadro de depresión para no hacerles acupuntura. Como pareciera plantearse como una contradicción.
No, these are cautions. This is something that the clinician must address and understand. Everyone is depressed. All cancer patients are depressed. If they weren't depressed, they wouldn't be normal. It's not nice to have cancer. It's horrible to go through cancer treatment. We expect a degree of depression. I am talking about a different level. I am talking about a level of severe psychotic depression, which has to be treated by a psychiatrist with medication. Trying to treat that kind of depression with acupuncture is hopeless. Acupuncture could be added, but it cannot be a primary treatment for that degree of severe depression.
Al auditorio solamente le aclaro que las preguntas concernientes a la charla de ayer fueron hechas el día de ayer. Hoy no se trataron temas como homeopatía u otras terapias, digamos, entonces nos vamos a focalizar en lo que fue la charla de hoy. Por eso no voy a hacer esas preguntas y voy a pasar a las que tengan relación con el tema de lo que ha sido la charla y la presentación de la doctora. Barrie, Estas preguntas están hechas probablemente por acupunturistas interesados en conocer las secuencias de puntos que utilizaron. Algunos aparecieron en los estudios de resonancia magnética funcional, pero por ejemplo los puntos que utilizaron para hacer ostomía, si utilizaron uno o varios puntos, y cuáles son los puntos que en sus trabajos utilizaron. Eso sería muy útil para nosotros.
Every published study is required to detail the acupoints. So any published study, whether it's by our group or others, if you go into PubMed, you can find the article and it will give the specific acupoints. It will also indicate how frequently acupuncture was performed, typically twice a week for 4 to 6 weeks, and it will also give other details about the acupuncture. As I mentioned yesterday, unfortunately, I am not an acupuncturist. I do not have in my head all the acupoints for the various studies that we have done, but you can find them online. All of our studies are published. The only one that's not yet published is our study of lymphedema, but that's not correct because it just came out last week in the journal Acupuncture and Medicine. So all of this information is online, and in fact, there are very strict requirements now for any paper that is submitted to a journal for publication involving acupuncture. All the points have to be listed and so on and so on. So every detail that a good acupuncturist would want to know will be included in those publications.
Yo igual, como soy amigo de la gente del servicio y de los acupunturistas, puedo decirle algunos puntos. Puntualmente, el trabajo de serostomía se utilizó intestino delgado 2. Ese fue el punto que se publicó, que estudió el doctor Gary Deng. Large intestine 2.
All right, we do a lot of P6. That I know because that sort of helps everybody. We also have found, and this is published not by us but by others, that this acupoint, when pressed, is extraordinarily effective for calming children.
La pregunta viene en esta línea, si utilizan acupuntura en niños ustedes, en su servicio.
We do occasionally. We are more likely to use acupressure, simply because we, until now, have not had enough acupuncturists to take care of all the patients involved. And the cancer patients, the pediatric cancer patients who come into our hospital, generally are so ill. They're treated sufficiently with pain medications. We would like to do more with them. We are actually starting a special program with the pediatrics group, and we'll be doing more work with them. But acupressure, especially for the tiny children, is better than acupuncture. It's just a lot easier, and they don't have to see a needle or even feel a tiny bit of a needle. There are also other integrative medicine therapies, complementary therapies, that work very well with children. The one that we use most often is a multisensory intervention. It's a little hard to describe. I don't know that it has a particular name, but it's one that uses all the senses, and we use this for infants. I mean, babies in the arms, babies, and older small children as well. And it is a matter of producing sounds and using color and using motion. And what it does is to put the baby into a hypnotic trance, an infant. And they can go through the most difficult treatment and they are sound asleep and comfortable. It's magic to see it. Works better than acupuncture for infants.
Bueno, hay una pregunta acerca de acupresión o digitopuntura que con los niños creo que ya la respondió. Y la última pregunta que nos quedaría sería, respondió con los niños y con el punto pericardio 6 o A1 que se utiliza para ansiedad y náuseas, ¿sí? Es un punto muy efectivo. La última pregunta sería si tienen alguna experiencia en tratamiento con acupuntura del síntoma cansancio inducido por inhibidores de la tirosina quinasa en tratamientos de la leucemia amiloide crónica. Algo bastante específico de hematología. Se llama imatinib, so on.
We conducted a study of fatigue experienced by cancer patients. And it is not yet published. We recently finished it. We're writing it up. We found a negative result. Acupuncture did not relieve fatigue. It was a large randomized study. We were very disappointed. But that's what research is about.
El primer estudio en fase 2 les había dado positivo de fatiga, de cansancio.
The pilot study was positive. That's why there's always a sequence of events in research. You know, you start out doing a small pilot study for safety, and then for efficacy, if it looks good, then you do a larger pilot. And when originally it seemed that acupuncture did play a role in relieving fatigue, we went to a proper study. And the randomized study, which is the only kind of study that gives us results that we can rely on, just did not show the expected effects. This happens all the time in research, in regular standard scientific research as well as integrative medicine research. You do your best, but it doesn't always come out as you hope.
Esto quizás sea un buen mensaje para que nos llevemos a casa nosotros en nuestro compromiso. Con todos los fondos que tienen y con todas las oportunidades y los excelentes estadísticos que tienen, que me consta, inclusive en un primer estudio fase 2, que algo aparentemente parece ser promisorio o dar resultados positivos, tenemos que tener honestidad científica todos, y eso es uno de los mensajes que realmente deseamos transmitirles desde ASOI, que seamos honestos y comprometidos, estemos comprometidos con la investigación, aunque podamos hacer poca, que la hagamos de calidad y buscando la verdad, porque lo que va a ayudar a los pacientes o no los va a ayudar es la verdad.
Absolutely true. Yes.
Muchas gracias, Barrie. Muchas gracias a todos.
Thank you.